Hello, welcome once again to Moorgate Andrology. Now in today's video I want to talk about penis enlargement surgery and what are called maximum girth options. So at Moorgate we see a lot of guys who really want to get as much penis girth as they possibly can, and there are options to do that. It should be said before we go any further that for example, a penis girth fat transfer at Moorgate, it is a pretty substantial fat transfer. We are now transferring far more fat due to improved techniques than we were only 5 years ago, and the majority of men are perfectly happy after one fat transfer. But if you're really looking for something with what I call super girth, then you do have options beyond the first surgery. So the initial surgery is either typically a lengthening increase and a girth increase at the same time with a fat transfer, or maybe just that you have the first fat transfer if you're happy with your penis length. Now, the option to add extra girth can come in two forms. Firstly, we can do a second fat transfer to add to the first one. And this is the most common option when it comes to guys who want super penis girth. And this is usually done between 3 and 6 months after the first fat transfer. Excuse me. The reason for that is because we want to allow some time for the first fat transfer to settle down. When you've had a fat transfer, here at Moorgate, we do a pretty big one because we know that in the first 8 weeks, around 30% or so of the fat that we transferred will disappear. This is a natural phenomenon. You cannot prevent it. And we allow for that in the amount of fat that we transfer in the first place, because we know this is going to happen. So we need a little bit of time before we do the second fat transfer. So typically 3 to 6 months later, you should be fine to go ahead and have a second fat transfer, at which time your penis will be very, very thick. Now, if you are one of those guys who would like some more girth, but you don't really want another surgery procedure, because remember, a second fat transfer will mean another minor surgery, then you can top up the fat transfer, the first one you had, with hyaluronic acid injections. So these are another way to increase penis girth. So after the fat transfer, you can come by to the clinic and one of our urologists can inject typically around 10 milliliters of hyaluronic acid to top up the girth fat transfer and give you even more girth to your penis. Now, hyaluronic acid injections are a very easy way to increase penis girth, but the one thing you should know is that they are not permanent. You will need to have them topped up to maintain this super girth. Depending on the filler you choose, typically most guys will return within about 18 months and have what's called a top-up treatment. They're called top-up treatments because you will only need about 50% of the amount of filler you had in the first place. So for example, if you did have that 10 milliliters top-up, then in about 18 months to 2 years, you're probably going to need about 5 or 6 mil typically to top up. So that's another option to increase your girth even further after the first fat transfer. So if you're looking for super girth, you're looking for a penis which is really, really thick in both the flaccid and the erect states, then this is something that you could consider. If you're wanting to know more about penis enlargement surgery generally, do please get in touch with us here at Moorgate Andrology, and we could always arrange a consultation for you with one of our urologists. Well, that's all from me today. I hope that's given you some insight into getting the maximum girth possible to your penis. That's all from me today. I'll see you next time back here at Moorgate. Bye for now.